Good afternoon, everyone. Thank you so much for joining us today. We will be discussing some current efforts to improve Nevada's behavioral health workforce. I know that when you registered, it probably said part one because we are getting into the legislative session. We're actually not going to schedule any more webinars for this series, but we do intend to move forward with other webinars to keep you abreast of what's going on with the behavioral health system, what programs and services are out there. It'll just be under a different title. So without further ado, let's go ahead and do some housekeeping. This webinar is being recorded. Recordings are made available on YouTube. My handle is NV Rural RBHC. Um, we're also sharing them with our partner organizations who may post them on their websites at a later date. The slide decks, as there are slides, are available at nvbh.org. You should be automatically muted, but if for some reason you come off mute, please go ahead and mute yourself. If not, I do reserve the right to mute you for you. If you haven't already done so, please enter your name, title, and agency in the chat. And we're going to go ahead and hold time for questions until the end of the presentation. There is a Q&A button. You should have like a circle on your toolbar that says more, or it'll just have Q&A right there. If Q&A doesn't appear, press the more button and you'll have a Q&A option. You can put any questions you have for our panelists and our presenters there. Again, we will be saving those for the end. You can also ask your question live at the end by raising your hand. This is a collaborative project from the 5 regional behavioral health policy boards, as well as the Nevada Public Health Association's Advocacy and Policy Committee and the Behavioral Health Association of Nevada. And the purpose of this series is to give you, our participants, a snapshot of what's going on in Nevada's behavioral health systems in different areas, leading into the legislative session. In past sessions, we've seen people who want to advocate or see things happen that are maybe already underway from previous statute changes, but it takes so long that they maybe haven't seen it yet. So we wanted to kind of roll this out as to what's going on right now so that everyone is aware. We have made our best efforts to include speakers in this series who are subject matter experts who do not stand to gain politically or financially by their participation. We do have some more upcoming webinars. These are all next week. So next Monday at noon, we have Youth Behavioral Health in Nevada, State Level Suicide Prevention, presented by Miss Emma White from the Nevada Office of Suicide Prevention. She is not only an amazing professional, but she is also a very talented nationwide speaker, author, and advocate for youth suicide prevention. On Wednesday at noon, we have Nevada's crisis response system. You may have heard of crisis stabilization centers and mobile teams and 988. Well, let's talk to the project officer who's weaving them all together at the state and talk about timelines, what we can expect, what's not going to happen, etc. That Thursday, at noon, we have an overview of the Surge annual report from 2024 by Dr. Terry Kearns at the Nevada Attorney General's office. And last but not least, you may have heard about Nevada's agreement with the Department of Justice for really revising and making major changes to our youth behavioral health system. Well, you will get to hear on Friday from Ann Jensen, who is the lead of that transformation program, about what's in store for that particular strategy, what they're working on, and what the agreement includes. A little bit about the policy board. So there's currently 5 regions. You can see them all there. They consist of 7 to 13 members. They represent local and professional perspectives, and they advise state level agencies and commissions such as DPBH, sometimes DCFS, and the Commission on Behavioral Health as far as what's going on at the local level and what the needs really are. Each board is allowed 1 bill draft request, or BDR, each legislative session, and membership of these policy boards is completely volunteer. Nobody's getting paid. The only person who is not a volunteer on the board is probably the legislator, and they're voluntold. They're still not paid to participate. The regions, so Washoe is just Washoe County. Northern includes Carson, Churchill, Douglas, Lyon, and Story. The blue region, which is the one that I get to serve, is Elko, Eureka, Humboldt, Lander, Pershing, and White Pine. The southern region in green includes Esmeralda, Lincoln, Mineral, and most of Nye County. And then Clark region includes not only Clark County, but also the southern tip of Nye County. That includes Pahrump. Each of the policy boards is staffed with a behavioral health coordinator. I'm there in blue. My name is Valerie Haskin. Also, we have Dorothy Edwards for Washoe, Cheryl Lynn for Northern, and Mark Funkhauser for Southern. We're the unofficial staff for the policy boards. We work on their behalf, and we also try to connect all of our local stakeholders and agencies, and our state level partners just to make sure everyone's on the same page and resources are being used the best we can. All right, so without further ado, I'm going to go ahead and turn it over to Dr. Tara Rains from Children's Advocacy Alliance. Dr. Rains, go ahead.
Hello, thank you so much for coming. My name is Tara Rains, and I'm Deputy Director at the Children's Advocacy Alliance. We are a statewide nonpartisan nonprofit that focuses on policy advocacy in the areas of issues that impact children and families here in Nevada. And so our primary areas of advocacy are child welfare, health, including both mental and physical health, and early childhood, that prenatal to 8 period. And so, what we have done as an organization to better understand what are the needs in Southern Nevada specifically, and also Nevada statewide, in regards to mental health, is we have formed what actually Dr. Pruitt named our Children's Mental Health Action Coalition. And that coalition is a group of about 70 providers, parents, trainers, community members who care about children's mental health. And through working with that group, we were able to identify a number of holes in our children's mental health systems here in Nevada. And one of those holes is, as you all are very well aware, is workforce, right? We struggle to meet the needs of our kids at the highest level, the most intensive levels, and we also don't have the folks with the training to meet the needs of our kids at one of the lower levels, right? That prevention, that risk period before their behavioral health struggles manifest and escalate into bigger mental health disorders and challenges. And so, in working with our coalition, we did some research, and what we learned was, I'm going to get to the behavioral health workforce part, I promise. This is the preamble. What we learned is that there are folks around the country who are working to professionalize and streamline the work that happens upstream, right? That risk-oriented work. And so, if you think of that analogy where the people are walking in the woods and they come across the stream and they see there's babies in the water and they start pulling the babies out, right? And then someone walks upstream and they're saying, "Where are you going?" They said, "I'm going to go see where the babies are coming from." We were able to identify some folks at the University of Oregon who are doing work to figure out how the babies are getting in the water, right? To do that early intervention and prevention work. And so we're super excited that we have an appetite to build that profession here in Nevada to be part of the workforce. And so, from the work of the Children's Mental Health Action Coalition, we have a bill, SB 165, that we are absolutely thrilled about. And I'll tell you a little bit more about what that looks like. But it's to create what we're calling a behavioral health and wellness practitioner. This would be a licensed professional here in Nevada who, under supervision, would be able to bill for reimbursement. And this individual, should this bill pass, with all of your support, of course, because you're here to support, should this bill pass, this is an individual who can work in schools, they can work in the Boys and Girls Club, they can work for communities and schools, they can work in a pediatric office, right? These would be folks who are trained at the bachelor's level to work specifically in risk identification, screening, and kind of that low level tier one, tippy bottom of tier two type intervention work, right? These are folks who are trained in typical development as well as the warning signs of atypical development, and also trained specifically to identify and refer out, because we want to make sure that these folks aren't practicing beyond their scope because they will be at the bachelor's level. Now, what's super sexy about this is, as most of you know, most folks who graduate with a bachelor's level degree in a mental health field never touch a child or a family, right? Like they've never seen them, they're not working with them. A lot of their work is theoretical or preparing them to get to a graduate degree, a higher level degree. And so one of the things that's cool about this particular framework that we're modeling after the Ballmer Institute at the University of Oregon is this particular framework um, has built-in supervised hours during the bachelor's program. So it's more like when we think of like a bachelor's in nursing, where there's 2 years of general coursework and then there's 2 years of coursework with embedded practica to really give that exposure and help folks have, some hands-on experience before they enter the workforce. So we're hoping that this will really kind of fill a need of getting folks to support our higher level mental health professionals by taking on some of that preventative and health promotion, mental health promotion work. Um, we have, and I'll share my screen to talk a little bit about how you can get more information and see what we're doing as a whole at CAA. And I'll show you through our website. So at CAA, because it is the legislative session, which is our busiest time of year, we have information available about all of our bills. The Behavioral Health and Wellness Practitioner bill is our primary priority in regards to workforce. But we also have two other children's mental health focused bills. One of them is the Office of Children's Mental Health. So another thing that came out of our coalition is the recognition that we lack leadership as a state when it comes to children's mental health, right? Groups like this group and others around the state give incredible recommendations, do needs assessments, have strategic plans, and we just don't have a point person or a place to say, okay, we're doing the strategic plan, we're evaluating the strategic plan, we're moving the needle, we're tracking the data. Like that just doesn't exist for us here in Nevada. And so one of the things we're asking for is an Office of Children's Mental Health. And we know that in the governor's budget, there is space for an office of mental health. And we just haven't received information about what that will look like specifically for children's mental health. So if you have it, send it to me. So for now, we're pursuing an Office of Children's Mental Health at the state level. We're also asking to mandate insurance coverage for screening and assessment for fetal alcohol syndrome spectrum disorders, attention deficit hyperactivity disorders, intellectual disabilities, and specific learning disorders. We know that the screening can really change the trajectory for children in these areas, and we know that the screening isn't happening. And what we've heard from providers is that it's because they're struggling to get it reimbursed. And so we want to encourage folks to do these screenings and engage in these assessments by mandating that insurance companies cover it. And then again, building that behavioral health workforce. In the bill for the behavioral health and wellness practitioners, we've also asked for funding for to cover scholarships for students at the graduate level and at the bachelor's level who are pursuing degrees in child behavioral health related fields. So we're hopeful that we'll be able to really address this shortage through the training pipeline. And I'm sure you'll hear more about that from Dr. Hunt and Dr. Pruitt shortly. For more information about what we're doing in the legislative session, oh, we also have these beautiful one-pagers. So if you would like information, I'll download the children's mental health ones and I'll upload them in the chat for you all in just a minute. But these are also available on our website. And then we also, every Tuesday at 11:30 a.m. from now until the end of the session, we have a check-in meeting where we talk about what bills, what meetings, what hearings are coming up and how they relate to children and child welfare and mental health and physical health and early childhood. And then finally, we also have a bill tracker. So this is a way that you can look for bills that are related to children's health. So for example, what comes up right now, they're in numerical order. But we have them labeled health, early childhood, and where we stand on it, these various bills. So for example, this one's a fetal alcohol spectrum disorder treatment assistance bill that we're excited about. There's an outdoor recreation bill we're excited about. So you can, if you go to our website, look through and learn more about what's happening in this legislative session. And again, we want you involved. If you're interested in joining our Children's Mental Health Action Coalition, you can shoot me an email. I'll put my email in the chat in just a few minutes as well and get added to our mailing list. We meet the second Tuesday of every month at 10 a.m. And we are really committed to action, as Ashley or Dr. Pruitt said, and making sure that we can hold the state accountable to really improve outcomes for children and families here in Nevada. So that is what I have. I'm open to questions, or if we want to go through and allow Dr. Hunt and Dr. Pruitt to present, and then we can do some questions. That'd be fine too. Take it away, Dr. Hunt and Dr. Pruitt.
All right. I'm the Children's Advocacy Alliance is always doing amazing things. So it's great to have that update. Good afternoon, friends. Ashley and I are here to talk about Be Here Nevada. Some of you may already be very familiar with Be Here Nevada, and others may not. So we're going to just start with kind of a quick overview of what Be Here Nevada is and how we are addressing behavioral health workforce needs in our state. So I'm going to pull up our slides. And here we go. All right. So I'm Sarah Hunt. I'm the executive director for Be Here Nevada, and I'm joined by my colleague, Ashley Noel Pruitt, who is our associate director for business technical assistance and policy. So I'm going to spend just a few minutes going over the history of Be Here Nevada and then what we actually do. And then Ashley's going to finish with a couple slides on some bills specific to behavioral health workforce development that we're interested in tracking. So Be Here Nevada actually started in last session through the bill that the Rural Regional Behavioral Health Policy Board carried, which was Assembly Bill 37. It essentially authorizes the establishment of the Behavioral Health Workforce Development Center of Nevada, now known as Be Here Nevada. And the idea here is for this center to live under the Nevada system of higher education to really try and grow our own model of a behavioral health workforce pipeline. It's based on a successful model that's been going for over a decade in Nebraska under the University of Nebraska. And there was similarly in 2022, a center created in the state of Illinois that's also under their system of higher education. The nuts and bolts of AB 37, what it really instructs us to do in this new behavioral health workforce center is to focus on we think of it as three parts to this pipeline of workforce development. The first part being recruitment. So I'm a psychologist by training. I know many of you are behavioral health professionals on the call today. Historically, we just have not shown up in the K through 12 space to promote our career pathways and our career options. So in that recruitment bucket, we think about ways we can go out in the K through 12 systems across the state and start talking about not only the career pathways that exist in behavioral health, but also what are the educational opportunities in higher education to stay in our state and train to start the journey on those career pathways. We also are interested in outreach to those potential adult learners. So maybe those folks that are already working as paraprofessionals in healthcare or behavioral health, or those individuals that are looking for career change altogether. How can we connect them with the opportunities that exist in behavioral health? And then that education part of the pipeline is very important as well. So if we do a good job of recruiting and get folks interested in behavioral health careers, we want to make sure, again, that they know all of the different training programs that exist under the Nevada system of higher education and make them aware of maybe what's the most accessible higher education door for them, whether it's at one of the universities, UNLV, UNR, Nevada State University, or starting through Great Basin College or College of Southern Nevada. And we also want to make sure within the higher ed system that we're removing any barriers that exist from transferring between institutions. So if someone completes the mental health tech certificate program at College of Southern Nevada, then there's no issues with transferring the credits from what they've already completed if they move over to Nevada State or UNLV or another institution. And then the retentions part of the pipeline is very important. So what can we do to best support the existing behavioral health workforce so they're not leaving our state or leaving the profession altogether? And we certainly want to make sure as those students are finishing their degree programs in the higher education system that they understand the pathway to certification or licensure or employment in our state. One of the other pieces that is unique about our Behavioral Health Workforce Center that we're going to work on developing is kind of a technical assistance branch of Be Here Nevada, which would offer some guidance or some information to those folks that are interested in maybe setting up a new agency, clinic in the state providing behavioral health care. We don't have that fully developed yet, but that is on our to-do list. As far as how we're structured, so Be Here Nevada is based kind of on a hub and spoke model. So we are administratively housed at the Kirk Kerkorian School of Medicine at UNLV. So we administratively live under UNLV, but we have networks for branches out to the different training programs and institutions across the state, building those partnerships. So we really want to consider ourselves a statewide initiative, not just focused on Las Vegas or Southern Nevada or the UNLV area. So what have we done since the bill passed in the 2023 session? We officially started in October of 2023. So here's a little bit of what we've been doing. This work doesn't happen without a team. So at this time, we are fully staffed with 8 full-time staff and a graduate assistant. And I'll note that our staff right now is, I think we're pretty much equally balanced. Some of us live down south and the others live up in Northern Nevada. We really started working on developing our marketing and outreach, coming up with our logo, coming up with our social media platforms. We have a really robust monthly newsletter that we will have an opportunity to get you all to sign up if you're interested. And a lot of what we did in the first few months after we opened in October 2023 was a lot of follow-up presentations with stakeholders. So telling them that, yes, the bill passed and here's what we're going to do about it now. We also engaged in some early listening tours. So we really wanted to have a good sense of training programs that exist across Nevada in the higher education system. So we met with all of those programs. And then we met with all the folks that have some contact in the K through 12 space, met with our different workforce centers, licensing boards, and employers. Along the way, we were fortunate to pick up a grant. So about a year ago, there was a call from Nevada Department of Health and Human Services for a grant to expend some of their ARPA funds. And this specific grant was about healthcare workforce development. So we had the opportunity to submit an application and were awarded just over $750,000 to put towards covering scholarships for 24 students who were going into master's programs in either social work, marriage and family therapy, or mental health counseling at both UNR and UNLV. So over the 2 years, we are going to fund full tuition and fees for 24 students across those 2 universities and 6 different programs. We also wove in a mentorship piece for those selected scholars, so they're connected then to community behavioral health providers. We've also started doing some surveys to get a sense from the employers and existing workforce. What are some practices that folks are already using to try and recruit individuals into their open positions, and what's being done on the retention side? So we want to get a sense of what are maybe some best practices that different agencies and employers are finding to be helpful. One of the things that our bill also asks us to do is address supervision. So once we train, especially those master's level clinicians, those social workers, marriage and family therapists, and professional counselors, after they finish their programs and graduate, they have to do a state internship or an internship that's approved by their licensing board. We recognize that there are some shortages in supervisors in certain parts of the state. So one of the things we've started this year is collaborating with UNR. They created a course that's being offered this semester for already licensed marriage and family therapists, professional counselors, and drug and alcohol counselors who maybe have thought about becoming a supervisor, but just need that additional training to do so. So at this time, we've got 17 licensed folks that are currently in that course learning how to become a board-approved supervisor. So we're excited about that effort. Ashley will talk about some of the bills that we're tracking, and then our bill requires us to do a yearly legislative report. And so we are just finishing up our draft for the calendar year 2024. And that's shared with some stakeholders as well. And we hope to get that added to our website once it's done. I do want to highlight some of the work we've been doing in that K through 12 space. So thinking about that recruitment kind of part of the pipeline section, which is very important. Since October 2023, we've been able to participate in 23 outreach events that have some direct contact with high school or middle school students across the state. So we estimate at this point we've had accessibility to over 1,000 students across northern and southern Nevada, which is really exciting to talk about specifically just behavioral health careers. We've also been able to partner with some of our area health education centers across the state, the AHECs, that are doing some of that healthcare workforce recruitment in K through 12. And we've also been able to partner with some of the the college prep programs that exist at UNR. And we've developed a really strong working relationship with a a human and social services career and technical education program at Reed High School in Reno. So those are students in high school that have already kind of identified that I'm interested in maybe those human and social career pathways that would include behavioral health. So we've been doing a lot with that classroom and that teacher. And we also presented this past summer at a state conference for career and technical education instructors, just to make sure that they know Be Here exists and what we can do to help support some of their career education in the classrooms. So what's next? We're going to keep working on those recruitment and retention initiatives, including we're about to have our first summer camp for high schoolers. So we have been working with the UNLV Early Outreach Office, and we are tentatively scheduled to throw our first camp at the beginning of June for high schoolers, where they'll be able to come on to UNLV's campus, get a lot of great activities and instruction on not only mental health related issues, but certainly those career pathways. So we're excited about that. Our bill requires us to put together an advisory consortium. That has taken a little bit longer than I thought it would, as we realize now that Be Here is in state statute. Our general counsel and NC counsel are working out the logistics of open meeting laws, and hopefully that will be resolved and we'll have an answer soon on that. I mentioned the business technical assistance program. So that now that we have Ashley on board, that will be something we will be building out a little bit more. Be Here is 100% state funded. So during the session, we are following the NC budget presentations. We are currently under the UNLV budget request, and so we hope all goes well in this session. Strategic planning, we're also asked to have a strategic plan in our bill, and it's also just kind of good sense to do. So we've been working on sketching out a draft of that. And then data. So that's an important piece of being able to show the impact that maybe we're having on the number of licensed professionals that we have in the state. So we just hired our data analyst, Allie Lovett, who started in January, and we've been meeting with the licensing boards on some of the data that would be accessible to us and how we can best put that together. We hope to have kind of an active workforce dashboard on our website. So more to come on that piece. And I'm going to go ahead and turn it over to Ashley to, again, just highlight some of the bills that we're looking at as well in this session.
Thank you, Dr. Hunt. So, access to mental health services, addressing provider shortages, and expansion of the mental health workforce is super important to the work that we do here at Be Here Nevada. So, we're keeping a finger on the pulse of legislation that's important to that workforce, as well as an eye out for legislation surrounding and impacting mental health. So, our current session, our 83rd legislative session, just began this week. And with that, we have a few focus points for us. So, we'll look first at 163, which is our Counseling Interstate Compact. This is going to affect our licensed professional counselors and those licensed in other states so that they're able to practice in Nevada. We also have SB 68, which is our Social Work Licensure Compact, which is also in the same arena. So we see a trend there. Then we have AB 60, which is Changes to Prevention Specialist and Peer Recovery Support Specialist. SB 47, which is support for a study of parity by the insurance plans to ensure that they are evenly across the board, ensuring that mental health services are available to folks. SB 78 revises provisions related to boards and commissions and councils and similar bodies, and this may impact the structure and oversight of mental health professionals and services. And then our SB 165, which is our new provider type, which we're bringing in that Dr. Raines talked about a little bit earlier. Next slide, please. Thank you. So let's take a little bit of time and talk about SB 78. So we've been hearing a couple brief overviews throughout the week in the different committees on SB 78. Some of the potential benefits I wanted to highlight for you all is that it's projected to save Nevada licensees a lot of money. So it's looking at about $19 million in projected savings. It can streamline operations and cut costs for us. It could also improve compliance, standardize regulations, and reduce conflicts of interest by ensuring proper state supervision. And I think another goal is to simplify processes for licensees. On the other side of that, we have some potential challenges for it as well, which is the loss of specialized knowledge if industry professionals decentralize. We know that a lot of our boards have people who have been long times in the field, and that knowledge is super important. So we would like to see clear planning for how that is able to transition. Different industries also have different needs. So the one size fits all approach may not actually fit all as it currently stands. So we're looking to see what comes next with that. And then for implementation, consolidating more than 100 boards and commissions into one board is also going to need some significant coordination. Finally, I think one of the things that has also come up in a lot of the listening that I've heard is that there may be some resistance from the impacted workforce groups and those affected. So we've been seeing a couple different white papers coming out, as well as some information on folks who are providing some other opportunities. That now is always the right time to be knowledgeable and get involved with the political landscape in Nevada. You can always visit the Nevada Electronic Legislative Information System, which is NELIS for legislative tracking. And you also can check out Monday's Regional Behavioral Health Policy Board panel and other prior webinars from this pre-legislative series. And that will provide some more in-depth information on the mental health workforce issues important to you as well. Next slide, please, and I'll send it back to Dr.
Thank you, Ashley. So again, those are some important bills that really have the ability to change the workforce landscape in Nevada when it comes to behavioral health. So I mentioned that an opportunity to sign up for our newsletter or follow us on our different social media platforms. If you are able to take a picture of that QR code, it will give you access to all of that. And then I will just note our little mascot in the corner. So that is Winnie the elephant. As I mentioned, we exist because of the bill that the Rural Regional Behavioral Health Policy Board carried in the last session. And that all started with a presentation I did in Winnemucca. So our origin story begins in Winnemucca, and that is why our elephant is named Winnie. So that's all we wanted to share with you today, and happy to answer any questions.
Oh my goodness, I didn't know her name was Winnie for that reason, Dr. Hunt. Think that is amazing. Thank you so much. If you have any questions, please feel free to use either the raise hand button on your toolbar, or you can type it into the Q&A if you feel more comfortable that way. While we're waiting for you guys to decide and formulate your questions, I just wanted to say it was so wonderful to have the opportunity to work with Dr. Hunt on this project and just build from her dream. This is her brainchild, and we're just so excited about what Be Here Nevada has done so far, because there's so many times that you have bills that launch different centers or groups or what have you, and they may be adequately funded, but nothing happens. And so I just super excited. I believe Fergus Loffridge, our board chair, is also on this call. So Fergus, if you want to make any comments, please feel free to raise your hand to let you know. But does anybody have any questions or comments for Dr. Sarah Hunt, Dr. Ashley Pruitt, or Dr. Tara Reams? Well, seeing none, it looks like you guys were just so thorough. We do have some documents in the chat from Dr. Rains. As far as, some of the things that they're recommending. I also popped a link to SB 165 into the chat. That is that bill that Children's Advocacy Alliance put forward. I added that to my own personal legislative tracker too. So good to hear that
Testify too. Come support it. I mean, you can come if you don't support it, but we'd rather you didn't.
All right. Thank you everyone so much for your time. We really appreciate it. And we will get this recording online as soon as we can. Thank you, everyone. Have a great day.